Hello. Where is everybody? This place is so silent. What is happening? Can you hear me? Can you hear me, guys? Mm-hmm. Let the chats keep going up. Where's everybody? We're just 15 here. Yeah, good evening. Hello. Good evening. Go and call them. Tell them to hurry up. Starting in the next few minutes because before you know it now, the time is already against us. Frankie, you say you are stressed. What is stressing you? You can't be stressed now. What is stressing you? Hey, Frankie. Hi. Uh-uh. Azana, you said you are stressed. Why is everybody stressed? Me too, I'm stressed too. Dora, are you stressed? Ha! If Dora is stressed, then everybody is stressed. Let me see. Uwana, are you here? Dr. Benedicta, I greet you. Dr. Benedicta, you cannot be stressed. You cannot be stressed. If everybody in this chat is stressed, you cannot be stressed. I don't believe you. Hey, Prissy, we are all stressed. Okay, you know what you do? I need everybody to just get a bottle of water. Let's see if we can finish it together. Everybody gets one, just one. Hurry up before we start so that we can reduce stress. Hurry up, everybody. I don't look stressed. After clean your mouth. This pressure is getting worse. Get a bottle of water like this. Just bottle of water like that. Oh yeah, let's go. Everybody together. This is the stress therapy. Let's go. If you start, don't stop. If you start, don't stop. Okay. Okay, hold on. Stress over. Alpha, did you do what I just did now? The material is not clicking fast enough. Alpha, did you do what I just did? Yes, get the energy. Yes. You see, I feel better. Okay, guys. The material is not clicking fast enough. Yes, get the energy. The stress gives me chest pain. Hey, just drink water. This thing I just did now, do exactly what I did and you'll be fine. Trust me, both the people that have chest pain, the people that are wondering about 75 questions, the people that I am dreaming the questions from quizzes. Yeah, you are dreaming that the questions from Amen. May your dream come to pass. What are we getting one of? This bottle water. I just finished one. I said drink it and get yourself so that we can start. Very fast. Very fast. 1 minute. Water gives blood pressure. Yes, it goes. Water follows. Hey God, you're very funny. Is there sodium inside this water? Too much urinary system is worrying you. Okay, guys. Okay, what's up? Dilio. Oh, Colonel, I greet you. Welcome. I had a commercial. Oh, really? I don't know how to remove commercial in the stuff. Oh. Just increase his blood pressure because there's more water in his blood. No, the water didn't enter my blood. The water is going to my GI rather. It's going to my GI. Do you understand? So if the water in my blood is low, then the sodium can drag water into my blood and increase the blood pressure so that my blood pressure will be stable. But if it's not there, it will be filtered. You understand? If it's not needed in the blood, it will be filtered out. So since I'm not hypertensive, my blood pressure will always be stable. Very stable. In short, I don't know. I told you guys that I was drinking a concussion the other day and it dropped my blood pressure. I had to go and buy a fig to check my blood pressure. Let's start ASAP so that we can cover all questions. Okay. Thank you. So, guys, are we ready? Are we ready? Are we ready? First of all, I just want to say that I gave you guys quiz on Canvas. I gave you seven. There are 7 quizzes, 7 topics. Some people are playing with them because let me check. Hold on. Where is this stuff, Self assignments? I want to check something. Let me check. Let me use practice midterm quiz 5 and know how many people have done with 5. Quiz 5. Let me see. Moderate. You see what I'm saying? Just 3 people. 3 has done quiz 5. You guys are playing with this thing. Okay. Okay. You see now, like this is something I felt that before our review today, you guys must have done it twice. Do you get, like, how can practice with quiz 5 be just 3 people and each of them has only one attempt? You shot 2 people. Each of them has just 1 attempt. Why? The first person spent only 1 minute 42 seconds. Second person spent 20 minutes. Third person spent 40 minutes. Listen, guys. Somebody said I'm doing it tonight. Listen, it's not about doing it tonight or not doing it tonight. It's about you doing it many times. I was thinking that first day, like every day, you do all of them. The next day, you do all of them. The next day, you do all of them. I don't know where your exam. I think your exam is on Thursday and Friday, right? Now, by then, you must have done everything 4-5 times. So this thing you are doing now, some people will wait until 2 days to the exam, then they will rush. You will see the same question in your exam and you get it wrong. And you, assuming you see the same question in the exam, you get it wrong. I don't know why you guys are playing with it. I can only try as much as I can. You understand? The work is in your hands. You understand? And it's not in my hand. I've tried though. Okay, guys. So today we are taking 3 topics. Very fast. We will be very fast. And being fast depends on you guys. They are helpful, Professor. They don't need to be helpful. Professor, we are still working on them. No, you are not working on them. No, you are not. How can you tell me that quiz 5, only 3 3 people. In short, only 1 person, because the other 2 people just opened it and left it. Do you understand? It's something that I've told you, leave whatever you are doing. Apart from this life review that we are doing, leave every other thing you are doing. Do those things five times. I'm supposed to see in each person's stuff, I'm supposed to see 5 times that you've done it, because I will see when you did it. You understand? So you have to do it, learn it, understand the question. Why did you get this answer wrong? Understand it, study it. Okay, I can do as much as I can. So which topic do you guys find most challenging? Which topic should we start today? We're going to take 3 topics quickly. You don't need to, you made a study guide out of chapter 5. Just focus on the quizzes I gave you and the life we are discussing. Those are what you need. Leave every other thing. Don't say I didn't say. Please, guys, Professor, are we still working on them? Are we still working on them? What are you talking about? Afwa? You say, are we still working on them? What are you talking about? Okay, let's start with respiratory. Yes, because I didn't take 1 class respiratory, but it's going to be in your exam. So I want us to take at least 30 to 40 questions on respiratory very fast. So what you do for me is that you guys have to answer very fast. Even if you don't know the answer, please just write, I don't know, or 911, or emergency, and that's it. You understand? We have to move very fast. I'm not going to do a lot of teaching. I'm going to do a lot of questioning. Please, you have to go with me. Some people are busy, writing down the question and all those things. You don't need that. You don't need to waste time. Now, you waste our time. So what you need to do is just focus, answer the question as if you are in the exam hall. I want everybody to attempt the question. Why we will slow down is when few people attempt it. I'll keep waiting for you. No. But if you attempt it very fast, we'll be able to go very fast. All right? Heart, for me, is challenging. Okay. After respiratory, we go to heart. The first person mentioned here respiratory. So after respiratory, the next thing that follows is heart. Any other topic you mentioned, we go through it. Okay. Are we ready? Okay. Professor, could you please put the questions and the options all in the chat? It's difficult. That's the problem. If I put the options in the chat, it's split. You understand? It splits. If I have to put it in chat, it will take me a whole lot of time. So that's why I always put the questions in the chat. But what I will do for you is, I'm going to make, hold on. Let me create. Let me create a new document. And I will share. Yes, this is better. Oh, okay. Anything circulatory and respiratory. Yes, we're gonna, okay, since you mentioned circulatory, we are gonna do respiratory system, the heart, then circulatory system. I think that's the most we can do this night. But it depends on you. If you guys are slow, then we take only 2 and we are good to go. All right, so let's jump into it as quickly as possible. There are 12 true or false questions. Can you kindly record this video so I can go over it? Of course. Why I'm using YouTube is because when after the video, after the class, just go to YouTube Live. Hold on, let me. Okay, so after the listing, just guys go to YouTube Live. If you go to YouTube Live, you will see this video. Just check the dates. You will see, you even see the ones I've done before. It's still the same thing. You understand? Like I know there are some people in this immediately they just jump into AP2. They just go to my videos and watch everything down. You understand? You see that it's still repetition. So you will see this video there automatically. I don't even need to do anything. You see this video there. Okay, guys. So let's start with true or false in respiratory, and we are going to go very fast. I want you guys don't waste time. Don't think too much, please. My tab is blurry. How? I don't know what you mean by that. I don't know what you mean by that. So, but let's start quickly. True or false? Quickly. This question: the maximum amount of lungs of air the lungs can contain is known as inspiratory capacity. Quickly. Quickly. Quickly, guys. True or false? The maximum amount of the air the lungs can contain is known as inspiratory capacity. Guys, you don't need to open your slide. You don't need to open anything. All you just need is attempt the question. All right? Just attempt. That's all I need from you. Attempt the question. Okay, guys. The answer... Okay. The answer is false, not true. And for me, it's very blurry. I think you should just reset. Maybe you log out and log in again. That would help you. All right. So the answer is false. You understand? False. The maximum amount of air the lungs can contain is not known as inspiratory capacity. It's known as what? It's known as what? Total lung capacity. Total lung what? Capacity. You understand? Total lung capacity. Any question? Because I want to be very fast. I'm jumping to the next question now. Guys, anybody's confused, just write now 1-1 and ask me the question here. I will definitely see. I'm seeing everybody's chats. Okay. Look at this question. That number one question I asked is false, not true. It's false. You are going to get some true and false questions in your midterm. All right. Look at number 2. Respiratory arrest is an irreversible condition. True or false? Respiratory arrest is an irreversible condition. True or false? Quickly, guys, quickly. Listen, you don't need to Google. You don't need to use AI. You don't need to do anything. Just attempt it the way you'll be attempting it in the class. All right? Quickly, guys. Yes, the answer is false. You guys are absolutely correct. You guys are absolutely correct. Respiratory arrest, it's a complete cessation of breathing. It's acute medical emergency, but the fun part is if it's very, very highly reversible, like it's very, very reversible, if medical intervention is delivered immediately. You understand? When it is irreversible, is if the brain and vital organs, are starved of oxygen for a very long time, it will not lead to permanent or widespread tissue death. You understand? That's what we call necrosis. But if you are, there's an immediate medical intervention, the person can be fine, come back very fine. So it's very reversible. All right. So that question is false. Look at this question. I really don't want to be explaining so much so that we can be fast. The pleural and the pleural fluid help prevent the spread of pulmonary infection to the pericardium. True or false? This is describing the function of the pleural. The pleural and the pleural cavity And the pleural fluid help to prevent the spread of pulmonary infection to the pericardium. True or false? True or false? Let's go. Let's this chat go up. Let the chat go up. Quickly, guys. Quickly. We don't have much time. Okay, very correct. All of you are correct. The answer is true. The answer is true. T for true. T for true. They prevent the spread of pulmonary infection to the pericardium. T for true. So look at this question, guys. Let's see what controls breathing. Look at this question. Breathing is controlled solely by the medulla oblongata and the pons. True or false? Breathing is controlled solely by the medulla oblongata and the pons. True or false? Quickly, guys, let's go. So the answer is false. All right. Somebody will be like, what? In the medulla oblongata and the pons, they have the core brainstem centers that generate and rhythmically tune the pattern of breathing. Yes, absolutely correct. But having sole control is different from assisting breathing. I don't know if you understand. The question talked about sole control. The truth of the matter is that the breathing can be overridden, modified, or even driven by several other distinct anatomical regions. For real. Like what? Like the cerebral cortex, like some specialized chemoreceptors. You know, so it's not necessarily or compulsorily just medulla oblongata and the pons. That's why that question is what? False. I hope you guys understand it quickly. Just 12 questions, true or false. Look at this question. The rate of oxygen diffusion is affected by the pressure gradient of carbon dioxide. True or false? The rate of oxygen diffusion is affected by the pressure gradient of carbon dioxide. True or false? Let's go, guys. Let this chat go up. Let the chat go up. Let this chat go up. So the answer is false. Look at the question. They said the rate of oxygen diffusion is affected by the pressure gradient of carbon dioxide. The answer is false. Why is the answer false? Pay attention. According to Dalton's law of partial pressure, all of you know the Dalton's law of partial pressure and also the Henry's law. Each gas in a mixture exerts its own individual pressure. All right? Its own individual partial pressure. So if these are two gases, this one has its own partial pressure. This one has its own partial pressure. Do you understand? And because they have their own partial pressure, if this one's pressure is more than this one's pressure, what will happen? This guy will diffuse more than this. It's as simple as that. This guy's partial pressure will never affect this guy. That's the idea of the law. You need to know this law. So according to Dalton's law of partial pressure and Henry's law of partial pressure, each mixture exerts its own individual partial pressure and diffuses independently down its own concentration gradient. You understand? So therefore, the pressure gradient of carbon dioxide, assuming this is carbon dioxide, it does not affect directly the rate of oxygen diffusion across the respiratory membrane. It doesn't. It has nothing to do with it. So the answer is false. Yes, the answer is false, not true. All right. I took time to explain it because a lot of people got it wrong. And guys, listen, it's okay that you get an answer wrong here than getting it wrong in the exam hall. So don't beat yourself. Just know the correct thing and we move. All right. Not move. You feel me? Okay. So let's go. Yeah, so look at this question. Gas transport is the process of carrying. Oh boy, somebody is. The answer is false. Do I need to explain it again? No. So if you don't catch the explanation after the video, just write down the time so that after the video you can go back to that particular time and understand that explanation I gave. All right. So look at the question I just posted. Gas transport is the process of carrying gases from the alveoli to the systemic tissues and vice versa. True or false? Let's go, guys. Let's go. Let's go. Let's go. Let's this chat go up. Let's go, guys. Let's go, guys. The answer is true, so I'm not explaining this. This one is very direct. Let's see the people that understand Bohr. According to the Bohr effect, a low level of oxyhemoglobin enables the blood to transport more CO2. True or false? True or false? Let's go, guys. Quickly. It says, according to the Bohr effect, a low level of oxyhemoglobin enables the blood to transport more CO2. True or false? You know, when we talk about, okay, guys, that's fine. I will let me explain it because it seems this one is I was even busy looking for another question. The answer is false, guys. The answer is false. Pay attention. Let me explain it. It says a low level of oxyhemoglobin. When you talk about oxyhemoglobin, you are talking about what? Deoxygenated what? Blood. So they are saying that, and that description is talking about Halding's effect. So you need to know Halding effect, and you need to know Bohr effect. That thing that was mentioned is actually Halding effect, not Bohr effect. That's why the question is false. I don't know if you understand. If that question said, according to Halding effect, a low level of oxyhemoglobin enables the blood to transport more CO2, I agree. It would have been true. But now, in this place, it says, according to Bohr effect. So the question is, what is the difference between Bohr effect and what is the difference between what Halding effect? That's what I need you to understand now, in case of anyone you see in the exam. When you're talking about Bohr effect states that high levels of CO2, pay attention, no, high level of CO2 and low pH, that's acidity. So when there is high level of CO2 and acidity, it decreases hemoglobin's affinity for oxygen. Wisdom. Put your hand on your head and say wisdom. When there is a lot of CO2 in your body, for example, now, if there is a lot of CO2 in your body, automatically your pH will reduce. I hope you know why. Because CO2 will react with water to form, carbonic acid. Now, so when there is a lot of CO2 in your body and there's high level of acid in your body, that's low pH, you feel me? Now, it's saying that your blood will unload oxygen. It will drop oxygen. So your tissue will start choking. That's what a Bohr is saying. So Bohr effect says High level of CO2, low pH, decreases hemoglobin's affinity for oxygen, forcing hemoglobin to do what? Push out the oxygen it's carrying. That is Bohr effect. But Howden effect says that a low level of deoxygenated blood, if you have low deoxygenated blood, it increases the blood's capacity to transport what? Carbon dioxide. So that means if your blood has a lot of what? Oxygen. You understand? It will increase the capacity, of the blood to carry what? Carbon dioxide. That's what he's saying. So you need to know the difference between the Bohr effect and the Howden effect in case of they give you that in exam. And this is a typical question for you. You may see this question or you may see a brother of this question. I don't know. I'm just telling you. Okay. Okay. So let's go, guys. So the answer to that question is false. That question is talking about what? Howden, not Bohr. If it's Bohr, it will be talking about what? Affinity. I'm talking about what? Acidity, pH. Do you understand? It will be talking about the pH and also the CO2. That's what it will be talking about. So please remember that. If you don't understand what I explained, please go back later and look at it. Okay? So this is number 8 for true and false. Look at this question quickly, guys, quickly. Erythrocytes do not carry out aerobic respiration, thus they do not consume any of the oxygen they are transporting. Erythrocytes, they do not carry out aerobic respiration, thus they do not consume any of the oxygen they are transporting. True or false? Quickly, guys. The answer is true, yes. It makes sense. It makes practical sense, all right? Aerobic oxygen. So the answer is true, yes. Look at this question quickly. After the terminal bronchi, air enters the alveoli next. True or false? Everybody has to be attempting. Everybody. Okay, guys, please, I want to bust your bubble now. I really need to bust your bubble. The answer to that question is false. Thank God we had this class. I'm so happy we had this class because if we didn't, a lot of my students would have failed this question if they see something like this. Please, guys, the answer is false. The answer is false. I need you to ask me why it's false. Oh, yeah, write why. Everybody, write why in the chat. Why is it false? Frank, your why has a lot of why. You people will not kill me in this class. Okay, guys. Yes, the answer is false because air does not just jump directly from the terminal bronchiole into the alveoli. No. Remember, guys, we have conducting zone. That's where air moves. And also we have respiratory zone, which is gas exchange. So normally how air moves is terminal bronchioles, then respiratory bronchioles, then to alveolar. That's how it moves. You can go look up the picture later. Later, not now, please. Later. You understand? So after the terminal bronchioles, you talk about what? Respiratory bronchioles, which is the respiratory zone. It's the next step. You understand? It's just a thin-walled tubules branching directly off the terminal branches. You see it will branch directly from terminal branches. You understand? Each of them will now, when they branch off like this. Okay, for example, this is the terminal branch, right? Then this is the respiratory bronchiole. See it? Terminal, this is terminal branch, this is respiratory bronchiole. This respiratory bronchiole now has round things to it. See? To it. These round things are alveoli. But before this alveoli, there is what? Respiratory bronchiole. This is terminal bronchiole. This terminal bronchiole is still part of what? It's still part of conducting zone. Okay. Okay. So the second to the last true or false question. Look at this question. This is a muscular question. The serratus anterior. Let me see. Hold on. The serratus anterior is active in eupnea. Eupnea is normal breathing, guys. Remember, eupnea is normal breathing. When you are relaxed, you see how I'm relaxed. I don't know if I'm relaxed. All of you are relaxed anyway. The spirit is telling me that you guys are relaxed. You see how you guys are relaxed when you are breathing normally. The question they're asking is, does the serratus anterior, does it help you to breathe? True or false? Is it part of the major respiratory muscles or is it an accessory? That's just the question. Quickly, guys. Only 4 people. What is happening? Are you people still recovering from the PTSD of the last question? So the answer is false, guys. When in the clinic, when you see a patient using muscles like serratus anterior, P minor, sternocleidomastoid muscle, know that that patient is having difficulty in breathing. And it makes sense. Serratus anterior is actually an accessory muscles of respiration. So you ask yourself, when do we use serratus anterior? Maybe all these people that have asthma, right? If somebody that is straining to breathe, you understand? Most times you see them, they bend forward, right? Once a patient is struggling to breathe, they will fix their shoulder girdle. You see me? In place. You understand? How do they do that? Most times they lean forward or they grip an object. I don't know if you guys have seen this thing in the clinic. You see somebody nature, the person will not even know when this thing will be lifted and when he'll be facing and what is happening at that moment. So this stabilization of that patient, right, allows the serratus anterior to reverse its normal action. What is its normal action? Its normal action is to what? To move what? The scapula. But instead, it will pull upward and outward. You feel me? It will pull upwards and outward. You understand? On the upper ribs. And when it does this, the serratus anterior will indirectly expand the lateral diameter of the thoracic cavity. So when that diameter enlarges, it will force more air into the lungs. This is how, so serratus anterior, sternocleidomastoid muscle, P minor, all these things are accessory muscles. You need to know which one is accessory and which one is main. And that's what they're asking you. Eupnea is normal breathing. So it cannot be accessory. Okay. So the answer is false. Last true or false for respiratory. PTSD after first exam. Please don't laugh me. Okay, look at this question. The expansion of the lungs during inspiration generates a pressure gradient causing air to flow into the lungs. This is an example of Boyle's law. True or false? True or false? Answer as if you're in the hall, guys. I need more attempts to be fast. Your attempts to be faster, guys. Yes, the answer is true. This is just normal breathing. Normal breathing obeys Boyle's law, right? Boyle's law states that the pressure of a given mass of gas, of an ideal gas, is it's inversely proportional to its volume at a constant water temperature. So this is a normal thing. I believe everybody gets this answer. So that's true. All right. Do you guys want us to also do true and false for heart before we start doing the main questions? Or should I just jump into the main questions? Suggestion. Suggestion. I need like 5 suggestions. Should we jump to the main question? Okay, guys. Okay, that's fair. Okay. Are we ready? Main questions. Are we ready, guys? Okay, so let me see. Okay, guys. So as I wanted to do initially, I'm gonna share this page so that I can post I can post the multiple choice questions there for you. How do I do this thing now? Hold on. Oh, sorry. No. 911. What is happening? No, your exam we have normal multiple choice question and true and false. So we just when I say main, I'm talking about multiple choice. Maybe I used the wrong terminology. Sorry. Okay. Okay, guys. So let's go this way. Let's start from the testing the microphone questions. Simple ones. Which of the following is not a function of the respiratory system? Which one is not a function of the respiratory system? Look at I'll post the options here, guys. Oh, this thing. I have to. No. Okay. I think this is better. So, guys, I'm trying to set up this thing properly. Sorry, I'm trying to properly so that to get bigger. Okay. So, sorry, I'm trying to set up this thing in such a way that it will be very big for me. Okay, guys, let's see. Which of the following is not a function of the respiratory system? We have control of pH, we have promotes the flow of lymph and venous blood, we have helps regulate blood pressure, we have assists in the synthesis of vasodilators, we have aids in defecation. Answer. Let me see. Yes, the answer is assists in the synthesis of vasodilators. It's actually not a function of respiratory system. It has nothing to do with them. Okay, that makes sense. Okay, so let's jump to the next question. I like the way you guys answered this question very fast. No, the answer is D, guys, not A. The answer is D, all right? So look at this question. Very fast, let's go. Look at this question. The answer is D, not A. You said what? Which of the following is not? They said not a function, all right? A, the regulation of blood pressure. B, the synthesis of vasodilators. C, the aids in defecation. D, regulation of pH. And E, regulation of body temperature. Quickly, guys. Which of the following is directly related to respiratory production of oxygen, of carbon dioxide, rather? Which is directly related to respiratory production of carbon dioxide? Quickly, guys. Yes, you guys are so correct. The answer is the regulation of pH. Regulation of pH, that's D. You guys need to already know this thing. Now, this is the pathophysiology mechanism of bicarbonate buffer system. Everybody knows bicarbonate buffer system, I believe. All right. So the respiratory production and elimination of carbon dioxide is a primary mechanism by which the body actually regulates acute changes in what? Arterial blood pH. That's how the body regulates it. It's a very simple thing. You get, and it's governed by a carbonic acid bicarbonate buffer system. All of us know this already. And guys, before I forget, because they can ask this question as a sub question, they can ask you the enzyme that catalyzes this reaction. It's called what? Carbonic anhydrase. Everybody, carbonic anhydrase. Okay. So the answer is regulation of pH. I'm jumping quickly. Look at this, guys. I hope you guys can see the screen very well. Please, if there is any fluctuation, any problem, just kindly state it because I may not know. All right? So look at this question, guys. Look at this question. The upper respiratory tract extends from the nose through the dash. Trachea, pharynx, larynx, alveoli, lungs. Answer. Answer, guys, quickly. Quickly, guys. Come on, if we go faster, it will make more sense, guys. One, two, three, four, five, six, seven. You guys have to be faster. This is the simplest question now. If you say, oh, I know it, and you don't respond, I'll be here waiting for you guys. And before you know it, we'll do only one chapter and I will go. It's already 9 o'clock. The answer is larynx. This is a question that we shouldn't waste 20 seconds, and we are wasting 1 minute on it. The nose is divided into the right and the left halves, called the what? Called the what? Nasal cavities, nasal fossa, nasal septa, nasal vestibules, nasal apertures. These are just testing the microphone questions. So you need to be very fast. The nose is divided into the right. You see, it will be terrible that they ask you the simplest question and you fail it in the hall. You feel me? In the hall. Here you can fail anything, no problem. Not a problem. It's tutoring. You understand? We are learning. So, but in the hall, you can't be failing questions. Quickly, guys. Okay, yes, the answer is B, nasal fossa. It's what divides the nose into two halves. Which two ligaments extend from the thyroid cartilage there? What are the most numerous cells in the lungs? What cells are the most numerous in the lungs? Yes, Prissy, most of them. You understand? What are the most numerous cells in the lungs? Quickly, guys, quickly. Should I give options in this one also? We have mucosa cells, we have type 1 alveolar, we have type 2 alveolar, we have dust cells, we have vibratile cells. There are some things I shouldn't be giving options because it slow me down. Come on, guys. We have mucosa cells, we have type 1 alveolar cells, we have type 2 alveolar cells, we have dust cells, we have vibratile cells. Yes, the answer is the dust cells. You guys are so correct. Look at this question. What supplies? Each alveolus is surrounded by a web of blood capillaries supplied by the dash. What supplies the alveolus? Quickly, what supplies the alveolus? Quickly, what supplies the alveolus? Aorta, pulmonary artery, pulmonary vein, inferior vena cava, superior vena cava. Which one? Which one? So whenever you hear about supply, right, you hear that word, supply. It's always what brings blood. Anything that brings blood is an artery. If you hear drain, that's what takes blood. Is what? A vein. So if you just know this principle, you already rule out superior vena cava, inferior vena cava, pulmonary vein. All of them are vein. Do you understand? You remove all of them. Sorry. Oh Jesus. My chest. So you're thinking about aorta and pulmonary artery. Aorta does not supply all those ones. So pulmonary artery becomes the answer. So the answer is pulmonary what? Artery. Okay. Now, A lot of things in the nasal cavity, in the respiratory tract, has hair. All right, they are ciliated. Which one is not ciliated? Which one is not ciliated? We have the nasal cavity, trachea, primary bronchus, terminal bronchial, laryngopharynx. Which one? Which one? Which one? Thank you. Which of the following does not contain ciliated cells? Guys, please, the answer is what? Laryngopharynx. Every other, or all of them, they contain ciliated cells apart from laryngopharynx. All right? Look at this. What is the basic distinction between an alveolar duct and an alveolar atrium? Alveolar ducts and the atrium. What's the basic distinction? The shape, their size, their function, their epithelial type, the presence or absence of cilia. Which one? What is the basic distinction between an alveolar duct and an alveolar atrium? Mm-hmm. Okay, this question is good. Quickly, guys, quickly. The answer is their shape. The answer is what? Their shape. The two of them are just microscopic structures of the respiratory zone, right? So it's just asking you about the architectural layout of the terminal lung parenchyma. That's just what this is asking you. You understand? So the alveolar duct is more like the hallway. Do you understand? And when you talk about the atrium, maybe the foyer, you understand? At the very end of the hallway, that's where you see the atrium. So it's the shape that differentiates the two of them. Because the ducts, there are hallways, is straight, elongated, tube-like in shape. Do you understand? But today, when the atrium is it's tiny, it's rounded. Do you understand? It's rounded and tiny. It's just like at the end of a hallway. That's how you think about it. All right. So their shape differentiates them. Look at this question, guys. Look at this question, guys. Come on, guys. Wake up, wake up, wake up, wake up. You guys are already sleeping. Which bronchus is about 5 cm long and slightly narrower and less vertical than the one on the opposite side? Which one? Is it the left segmental bronchus? Is it the right segmental bronchus? Is it the right lobar bronchus? Is it the left lobar, left main bronchus? Right main bronchus? Which one? Okay, 911. Okay, don't worry, I will explain. But I want people to still attempt, guys. Okay, guys. So let me explain. It's okay. It's okay, guys. It's okay. Let me explain. So the correct answer is the left main bronchus. You understand? Left main bronchus. That's the correct answer. So you ask me why. How do I explain this thing? Okay. I want you to, guys. I don't know if I'm very. Let me zoom myself more. You can see me better, right? Let's say this is the two lungs. Uh-huh. Yes. So if this is the two lungs, let's say, when the trachea bifurcates at the level of the carina, the level of carina, the one that looks like an underwear. If you can remember what I said. So at the level of the carina, the two of them bifurcate and enters like this. You see? They enter like this. So if this is the lung, this is the lung, the two of them bifurcate this way. Do you understand? So they split into the right and the left main bronchi. That is the primary bronchi. Do you understand? So because of the heart, so guys, watch. Assuming this is the left lungs. So the left lung is like this, and the heart is like this. If you remember, the heart there's a cardiac notch. So if this left main bronchus is supposed to enter the hilum of the lungs, for it to enter the hilum of the lungs, because the heart is here, it has to go round to enter the hilum of the lungs. You understand? So due to the heart tilting leftward into the cardiac notch of the left lung, right? So this left main bronchus must travel a longer distance to reach the hilum of the left lung. So because of that, it is roughly around 5 cm long, very long, and significantly narrower in diameter. Do you understand? Narrower in diameter compared to the right. And that's what they are talking about here. Listen, guys, this thing is very high yield in the clinic. It has a serious clinical implication. Why? Because if somebody is choking, I am thinking that where that thing is choking should be in the right. You understand? Because the right main bronchus is what? Is shorter, 2 to 3 cm than the left. I don't want to enter pathology right now, but I just need you guys to understand the question. All right, understand that this thing. I don't know if I've taught it in your class, but the answer is the left main bronchus. It's 5 cm long and slightly narrower and less vertical. It is less vertical because it has to circumnavigate around the heart. So if you just remember that the heart is in the left, then the left, this main bronchus is not direct, pim. But if it is right, it's just direct, pim, to the lungs. So that means if somebody is aspirating, there's every chances that it has to be on the right, because that thing gets to the lungs faster than from here. And because it's narrower, you understand, things don't easily enter inside it. That's the wisdom. So if you are a clinician, if somebody is choking, your first main point of view is what? The right. So that's the clinical significance of this information. I hope it's making sense. Are you with me, guys? Let me see how many people are still here. Some people have zoomed off. Some people are sleeping right now. How many people are here? If you are here, write yes. All right, I'm here. Anyone? Let me see how many I get. Let me know the people that are still with me. Quickly. Quickly. 1, 2. So I have only 10 people here. Ha, I was thinking I have up to 25 people. Oh. Terrible. Where's everybody? It's thinking a lot of people. What's happening to you guys? People in the other sets that have taught, when we are here like this, they are always a lot and a lot. What's happening to you people? Okay, guys. So that's okay. That's okay. Let's go, guys. The heart indents into the dash of the left lung. Option: oblique fissure, hilum, apex, cardiac notch, base. Quickly. This one shouldn't take you a minute. Nobody has answered. Oh, okay. Sorry, I didn't share my page. I posted it. I even thought I shared it. Look at the options. Oblique fissure, hilum, apex, cardiac notch, base. Quickly, guys. Quickly, let's go, guys. Let's go, guys. Quickly, guys. Cardiac notch. Okay. Now, this question, I'm not going to put options. Yes, the answer is cardiac notch, guys. That one is very giveaway. The lungs have a total of how many? Of 5 dash. Answer. The lungs have a total of 5 dash. The lungs have a total of that 5 dash. Perfect. 5 lobes. No time. No time to waste time. What forms cruise sounds? Cruise sounds are formed into intelligible speech by all of the following except pharynx, epiglottis, oral cavity, tongue, and lips. Quickly, guys. Quickly, guys. Yes, the answer is epiglottis. You are very correct. Which Which cartilage is the largest? Which cartilage is the largest? Yes, guys, the answer is epiglottis. It's B. You're correct. Which cartilage is the largest? Corniculate, epiglottic, thyroid, cricoid, arytenoid. Which one is the largest? Quickly, guys. Yes, you guys are so correct. It's thyroid. That's the biggest. You guys are so correct. Look at this question, guys. In a healthy person, which of the following will have the greatest influence on resistance to pulmonary flow? In a healthy person, let me give you the option. Quickly, guys. I'm not going to ask all the questions, but I'm trying to be very selective. Atmospheric pressure, respiratory rates, bronchi diameter, quantity of surfactants, and contraction of diaphragm. In a healthy person, which of the following will have the greatest influence on resistance to pulmonary flow? Quickly. Quickly, guys. Please, if you have a problem with it, just tell me so that I can just shed a little light. Okay, guys, you guys know that pulmonary ventilation is governed by the normal principle, which states that the flow of air is directly proportional to the pressure gradient and inversely proportional to the resistance. You understand? So all these things is governed by the diameter. Like the diameter is the major thing that comes into existence. That's why we have something called bronchodilation and the bronchoconstriction, right? When you're talking about bronchodilation and bronchoconstriction, that is actually like bronchoconstriction is usually by parasympathetic stimulation. Why bronchodilation is by sympathetic stimulation. Do you understand? All these things is just talking about how the diameter dilates, expands, or contracts. So it's talking about reduction of diameter and expansion of diameter. So that the bronchial diameter is extremely important. All right. So in a healthy person, if they say which one have the greatest influence on resistance to pulmonary airflow, it is bronchial diameter. All right. Not that others are not important, but it is always the bronchial diameter. Okay. So this question, I have very few more questions to leave you. Which law states that the total pressure of a gas mixture is equal to the sum of the partial pressures of the individual gases? They're supposed to give me this law without thinking. But okay. Without options, rather. But okay. I need you guys, you don't need to look anything. Just answer questions. Let's go. Later, you can always go back to this video. In short, whether you know it or not, you must always go back to this video. All right? Quickly, guys. Yes, the answer is C, Dalton's. Trying to compare these questions. Dalton's? Yes. Which law states that the total pressure? Quickly, guys. Quickly. I want us to complete this thing. I've already brought up questions for the hearts. So the faster we finish up, the better. So this question, which of the following is the term for the lungs resistance to expansion? Pulmonary ventilation, pulmonary compliance, pulmonary stenosis, pulmonary surfactants, pulmonary impedance. Quickly. Quickly, guys, quickly. Okay, I see this other question. So the answer is pulmonary compliance. You guys are not going to very fast. So I need you guys to go faster than this, guys, because I need you to go faster than this because I already pulled up almost 20 questions extra for this respiratory, and I want us to complete them because they are extremely important. You know, when I say something is important, you know me now. So this question, quickly, guys, quickly. The amount of air in excess of tidal volume that can be held with maximum effort is the dash. We have vital capacity, we have inspiratory reserve volume, we have expiratory reserve volume, we have residual volume, we have inspiratory capacity. At this level, all of you should have known the meaning of each and every one of these. So I'm expecting you to just give me the answer immediately. Immediately. Quickly, guys, quickly. 1, 2, 3, 4, 5, 6. We're almost 30 here now. Why am I hearing from just 6 people? Are we tired? Should we stop here? Should we stop here? I need to see energy. Like, I'm not feeling the energy, guys. The answer is inspiratory reserve volume. I need to see the energy from you, you know. Look at this question, guys. How is the vital capacity calculated? What's the formula? How is the vital capacity calculated? Quickly. How is the vital capacity calculated? Inspiratory reserve volume plus expiratory volume. Inspiratory reserve volume plus tidal volume. Expiratory reserve volume plus tidal volume. Expiratory reserve volume plus tidal volume plus inspiratory reserve volume. Respiratory volume plus tidal volume. Quickly. Quickly, guys. Yes, the answer is expiratory reserve volume plus tidal volume plus expiratory reserve volume. That's the vital capacity. You are checking everything in the lungs. All right. We want to know how functional the lung is. All right. So very fast. What was this called? Yes, the answer is D. Very fast. What was this called? Deep rapid breathing, often seen in terminal diabetes mellitus, is known as what? We have tachypnea, we have dyspnea, we have autopnea, we have hypapnea, we have Kussmaul respiration. What's the answer, guys? We have tachypnea, we have dyspnea, we have autopnea, we have hypapnea, and we have what? Kussmaul respiration. Quickly, guys. Quickly. Quickly, guys. Quickly. Come on, excited. Quickly, my people. So the answer is Kussmaul respiration. All right. I believe all of you know the meaning of each and every one of them. When you're talking about Kussmaul respiration, it's very, very specific. It's highly specific, and it's actually a compensatory breathing pattern. All right, characterized by abnormal, continuous, deep, and rapid respiratory breathing. That is Kussmaul breathing. Jesus Christ. That's Kussmaul breathing. Right? It's very classic clinical manifestation of what? Severe metabolic what? Acidosis. That's why when you see people that are, especially type 1 diabetic patients, you see them, they have something we call what? Respiratory ketoacidosis. You see them breathing like that. It's fruity. All right? It's fruity. It's just a compensatory, sorry, not respiratory, diabetic ketoacidosis, DKA. You understand? So, you know, it's just a compensatory reaction by the body. When you're talking about tachypnea is just a rapid respiratory rate greater than 20 breaths per minute. Right? Just like maybe when you are gasping for breath, maybe when you walk. I see some of you when you climb the story building, you are breathing like somebody that they chased. That's tachypnea. All right. So when you're talking about hypapnea, it refers to an increased volume or depth of breathing in response to what a metabolic demand. So this has to be metabolic demand, like with exercise. All right. Then we have dyspnea or autopnea. You understand? They are just, dyspnea is just a sensation of shortness of breath or air hunger. You understand? Why autopnea is dyspnea that is specifically occurs in a patient that lies flat. So when you lie flat, you know, in a recumbent position, that is what autopnea. All right. So autopnea is actually dyspnea, but when you are lying flat. Okay. So I just want to define each and every one of them. But remember Kusma. Kusma is always very important. It's always very, very important. Okay. So I want you guys to look at this question. I'm really taking my time in respiratory because there are some class that has not done it, but you get the questions. So I need you to focus pay more than usual attention. If you have any problem, ask me a question. And I don't know why the number is just 20 here. We're supposed to be going up. Instead, we are going down. Carbon dioxide is transported by all of the following except. Carbon dioxide is transported by all of the following except. Carbaminor, hemoglobin, carbonic acid, carbonates, bicarbonate ions, dissolved gas. Which one is the answer? Quickly, guys. Carbon dioxide is transported by all of the following except. I don't understand why we are this slow, honestly. You don't need to Google. You don't need to use anything. Just answer. If we are this slow, then I have to stop, guys. I really want us to be faster so that I can go do other things. If we are this slow, I'm just in respiratory. There are things you need to know in respiratory, which is what I'm trying to do. But I ask a question, and I get another question to ask. I look up and I see that most of you have not even attempted. If you are here, you have to make attempts. All right. The answer is carbonates. Look at this next question. Tom is in respiratory arrest due to an electrical shock. Why does a good Samaritan have to have up to 4 to 5 minutes to begin CPR and save Tom's life? Look at the options. I already posted the options. There is a reserve in Tom's lungs. There is a venous reserve of oxygen in Tom's blood. The ambient PO2. Okay, the ambient PO2 can support life that long. The Haldane effect, the Tom's hypoxic drive. Which one? Quickly, guys. Quickly, guys. The answer is B. There is a venous reserve of oxygen in Tom's blood. That one is very clear. I expect everybody to know that. Anybody, if you have any question, please write 911. The answer is B. If you have any question, write 911. Look at this question. During exercise, which of the following directly increases respiratory rates? Which one? I'm giving options now. Increase hydrogen level in the blood, the Bohr effect, reduce blood pH, reduce oxyhemoglobin, anticipation of the needs of exercising muscle. During exercise, which of the following directly increases respiratory rates? What increases your respiration during exercise, guys? When you go to the gym, all the gym people in this house. Come on, guys. Quickly, guys. Yes, the answer is E, anticipation of the need of exercising muscles. All right, that's the answer. That anticipation is very extremely important, and that's what increases respiratory rates immediately. Like if you monitor a patient on treadmill, for most of you that have been in cardiologic center, you will understand what I'm talking about. So, but I will leave it at that because we have other things to do. Oh boy. Look at this question, guys. Which of the following would slow down gas exchange between the blood and the alveolar air? An increase in membrane thickness, an increase in alveolar surface area, an increase in respiratory rate, a decrease in membrane thickness, a decrease in nitrogen solubility. Quickly. Quickly, guys. Yes, the answer is A, an increase in membrane thickness. Please, if there is something that is confusing, please ask me. Look at this question. Yes, the answer is A. Look at this question. The addition of CO2 to the blood generates dash ions in the red blood cells, which in turn stimulates our red blood cells to unload more oxygen. Sodium, potassium, nitrogen, hydrogen, chloride. Which one is the answer? Quickly, guys, quickly. Let's go. Quickly, guys. Yes, the answer is hydrogen. Now, if you don't respond that fast, I will just move. But I really want all of us to go together because I have very few questions on respiration. The other questions you will understand. Which of the following has no effect on oxyhemoglobin dissociation? Which of the following, which following are we talking about? We are talking about this. We're talking about epinephrine, fever, thyroid hormone, low pH, erythrocyte count. Which one has no effect on oxyhemoglobin dissociation? You guys understand what we mean by oxyhemoglobin dissociation curve, right? We are talking about, plotting the percentage saturation of hemoglobin against the partial pressure of oxygen. I hope you understand what we are talking about. You understand? So it illustrates hemoglobin structural affinity to oxygen under different physiological conditions. How does hemoglobin and oxygen marry each other? How does hemoglobin carry oxygen under different conditions? Low pH, fever, and all those other things. Do you get? Aha. So things that affect, like low pH, like fever, it has increased temperature. You understand? Like, for example, fever. When the fever, when there is rise in thermal energy, that's fever, it disrupts the weak bonds holding oxygen to hemoglobin group. Do you understand? Because of that, it will decrease hemoglobin's affinity and facilitating oxygen unloading. I don't know if it makes sense to you. So when somebody has fever, the hemoglobin will not be able to carry enough oxygen. Oxygen will be falling out from the hemoglobin because of fever. That's how it affects it. Low pH, acidity. That one triggers Bohr effects. Excess hydrogen ions bind to amino acid residues on hemoglobin. Do you understand? Forcing it to drop off oxygen. So that makes sense. Low pH causes a lot of the hemoglobin to carry oxygen. It will be too heavy for hemoglobin. It will just throw off oxygen. The same thing with thyroid hormone, the same thing with epinephrine. So, but the one that doesn't affect is what? Erythrocyte count. So you guys are absolutely correct. If you choose E, E is correct. Erythrocyte what counts? Erythrocyte what counts? Make sense? Please, if somebody's confused, please try to tell me so that I'll be able to clear you. And please, if you are not following this channel, try to follow the channel. Very important. So that you'll be able to, see more of this, even when you are doing other courses like pathology. And also, our website is coming out very soon, so I will explain it here later on. So look at this question. In the air we breathe, which gas is found in the highest concentration? This one, should I put option? No, I shouldn't. The air you breathe, which gas is found in highest concentration? Why are we wasting time in this one? This one is so cheap. The answer is nitrogen. And also, please, I'm not going to ask this question, but this question is asking you about how many oxygen does one hemoglobin transports? 4. How many oxygen does one hemoglobin transport? 4. Which gas is found most abundant, the highest concentration in the air we breathe? Nitrogen. How many oxygen is in one hemoglobin? 4. Okay. Oh, Jesus. I asked this question before. I don't know if I should ask it again. Let me see who listened to me when I was discussing this thing. I discussed it here. Look at it. Not like I asked the question, but I discussed this answer to this question. You understand? Which of the following enzymes in the red blood cell breaks H2CO3 down to water and carbon dioxide? Which enzyme is that? The enzyme I said that facilitates, that's in buffer system. Which enzyme is that? Quickly, guys. Options: hemoglobinase, carboxyhemoglobinase, carbonic anhydrase, bisphosphoglycerates, carboamino reductase. What's the answer? The answer is carbonic anhydrase. I mentioned it before. If you remember when I was talking about the buffer system, I mentioned it. I can remember vividly. You understand? Look at this question. This question will be asking you in terms of percentages. Yes, the answer is carbonic anhydrase. You can't fail it. In one passage through a bed of systemic blood capillaries, the blood gives about what percentage of oxygen? About what percentage of its oxygen? Look at the question. 5% to 10%, 10% to 15%, 20% to 25%, 30% to 40%, 70% to 85%. What's the answer? What's the answer, guys? Quickly, quickly, quickly. We don't have much time. Two, four, only 5 people? Wow. Wow. The answer is 20 to 25%. I wanted to ask you this question, but no, I can't be asking you this kind of question. Which are the following the term for a deficiency of oxygen or the inability to utilize oxygen in tissues? That's hypoxia. Everybody knows hypoxia. I can't be asking you this. We don't have much time. Look at this question. Which of the following is a lung disease marked by a reduced number of cilia, reduced motility of the remaining cilia, goblet cell, hypertrophy and hypersecretion, and thick sputum? Which was the answer? Oh, I should put your options? Yes, I will. I will. I will. We have asthma, we have oat cell carcinoma, we have atelectasis, we have chronic bronchitis, we have emphysema. Why did they put my oats in this option? Quickly, guys. Yes, the answer is chronic bronchitis. You guys are so correct. Remember what chronic bronchitis is? It's a classic form of COPD. All right. You know what COPD is? COPD is chronic obstructive pulmonary disease. You understand? Clinically, it's defined as productive cough lasting for at least 3 consecutive months in 2 successive years. 3 consecutive months in 2 successive years. That's what we call chronic bronchitis. And it's usually caused by chronic inhalation of irritants, specifically cigarette smoking, or heavy air pollutants. And, it causes remodeling. You understand? It causes remodeling, goblet cell hypertrophy and hypersecretion. You understand? It causes hypertrophy in the epithelium, changing the epithelium, from pseudostratified to stratified squamous. All right. It causes ciliary effect. It causes blue bloater, a cascade. That's what we call it. But I'm not going to explain all those ones now. But emphysema, you guys need to know the difference. Emphysema is actually part of COPD, right? It's still caused by smoking and other things. You understand? But emphysema is a disease of the respiratory zone, not the conducting airway. That's the difference. It's a disease of the respiratory zone. You know the difference, right? So it's usually characterized by irreversible destruction of the alveolar cells and loss of lung elasticity. The lung will not be able to expand, you understand, and reduce properly. So that's emphysema. And when you're talking about asthma is an obstructive airway disease. You understand? Caused by a reversible broncho constriction, you understand, or smooth muscle hyper responsiveness, you understand, usually by eosinophilic blah blah blah. Then you talk about atelectasis as well. All right, atelectasis is also used to describe a medical condition where the lung collapse, you understand, or a section of the lung collapse, maybe a lobe collapse. That's atelectasis, you understand. And old cell carcinoma is the same thing as what small cell lung wart carcinoma. You understand? Very highly malignant, very aggressive. In case of if they ask you in exam. All right. I'm taking time in respiratory because some of you didn't do respiratory in class, so you need to pay more than usual attention when I'm explaining some of these concepts. Okay. So the answer to that question is chronic bronchitis. Once you just hear, goblet cell hypertrophy, remodeling, hypersecretion, tick sputum, peak chronic bronchitis. All right. Okay. Look at this. Look at this. You said emphysema is big alveoli. I don't know what you're talking about, but emphysema, just know emphysema affects usually the respiratory zones. But apart from the respiratory zones, what it usually does is that it causes irreversible destruction of the not just the alveolar walls. It makes the lung to lose its elasticity. Alveolar walls is correct, you understand? Destruction of alveolar walls. But what it also does is it makes the lung lose elasticity. Remember that elasticity. If they are giving you a question on emphysema, they won't be able to just focus on destruction of alveolar wall. No. They will always also be telling you about that elasticity. That's what you should bear in mind. Sometimes in medicine, some of these pathologies, we use pointers to remember, to make the diagnosis. All right? For emphysema, that is his pointer. Okay? So I wanted to pose this question before I saw what you wrote. Which of the following will lead to anemic hypoxia? Which one? We have sickle cell anemia, we have emphysema, we have squamous cell carcinoma, we have asthma, we have atelectasis. Quickly, guys. This is the option. Quickly. Let's go. Quickly, guys. Quickly, let's go. This is a giveaway now. Why are we wasting time on this? I have just 5 more questions and I'm done with respiratory. Yeah, there's this question that is asking about large alveoli wall, and that is emphysema. Yes, I think that's why you were asking me about that alveolar wall, right? Yes. So another question can be asking you about the collapse, whether it can expand or reduce. That's also emphysema. So remember, but you are also correct in that. All right. So large alveolar wall, alveoli, emphysema, abnormally few, but large alveolar wall, alveoli, emphysema. Guys, remember that as well. Thank you very much for pointing it out. Quickly, guys. And any question that you see mycobacterium, know that it's tuberculosis. Mycobacterium tuberculosis. I'm seeing 2 to 3 questions on it right now, and I'm not ready to be asking them. All right, it's giveaway. If you just see any question, mycobacterium, what did I say is the answer? Talk. You are not talking. Talk. I want you to say it where you are. You don't need to type it. Say it where you are. Say mycobacterium. You choose what? Tuberculosis. Alveolar wall being big and few, you choose emphysema. All right. Alveolar wall being few and large, you choose emphysema. Anemic hypoxia, you choose sickle cell anemia. Thick sputum, hypersecretion, goblet cell hypertrophy, you choose what? Chronic bronchitis. These are pointers. If you see it in exam, piam, you pick it, piam, you move. You don't waste time. Do you understand? You don't waste time. And also, they can ask you a problem with malignancy with lamina propria. Look at this question. They will ask you malignancy with lamina propria. If they ask you this kind of question, if you see lamina propria, you choose what? Adenocarcinoma. Adenocarcinoma. What did I say? Let me paste it here. Oh, it's... Look at it here. Adenocarcinoma, not atelectasis, adenocarcinoma. If you see malignancy in lamina propria, remember what lamina propria is. Lamina propria is the connective tissue. You understand? You understand? So if you see that lamina propria, malignancy in the lamina propria, adenocarcinoma. You see how many times I'm repeating it? Let me see another malignancy that they can ask you. Look at this question. Look at this pathology. Yes, adenocarcinoma. Remember, for lamina propria. Your alveoli, a small number of quantity, big size. You talk about emphysema. Okay. Which of the following is the most likely to result from contact between contaminated fingers and nasal mucosa? Huh? All those children that take their hand and they are putting like this, what can it lead to? Quickly, guys. They play with their hands on the floor and they put it in their nose. What can it lead to, guys? Quickly, guys. Acute rhinitis, perfect. That's why children has it a lot. So I have 4 more questions to ask you. Just 4 more questions and I'm done. Look at this question. Look at this question, guys. Scuba divers breathe a nitrogen oxygen mixture rather than pure compressed oxygen in order to avoid what condition? Quickly. Do I need to explain this? Yes, the answer is oxygen toxicity. Do I need to explain it? Or I should move? Comments. Talk. Okay, I think I should move. Perfect. So everybody knows that, eh? So I have a very few questions to go, 4 or 5 questions. Oh, please, guys, before I forget, if they ask you any question about what produces mucus, remember it's goblet cell. It is goblet cell. It is goblet what? Cell. All right? What produces mucus is what? Goblet cell. Don't forget. I should move. Okay. Look at this. Nitrogen bubbles can form in the blood and other tissues when a scuba diver ascends too rapidly, producing a syndrome called what? We have decompression sickness. We have a hyperbaric disease. Let me put it here. Decompression sickness, hyperbaric disease, cerebral embolism, pulmonary barotrauma, and pulmonary edema. Quickly. Only one person. Guys, the answer is decompression sickness. I'm not going to waste time on that. I will not keep waiting for you. The blood transports more CO2. It's already past 10. I have to stop this and jump to this thing. But I have 2 more questions. When they ask you about how does the blood transport CO2, it is in bicarbonate ions. Answer, bicarbonate ion. That's how blood transports CO2. Do you understand? And then we ask you about Valsalva. We discussed Valsalva. You know what Valsalva is? Like when you are, defecating. You want to go to toilet, you want to poo, you want to urinate. That's Valsalva. All right? So I don't need to worry too much about it. Look at this question quickly. 2 more questions to go on respiratory. Blood banks dispose of blood. Let me put the option first. Blood banks dispose of blood that has low levels of bisphosphoglycerate, What would be the probable cause for doing so? Low BPG level causes acidosis of blood. Erythrocytes low in BPG do not unload CO2 well. Erythrocytes low in BPG do not unload CO2 well. Low in BPG do not unload. Erythrocytes low in BPG do not unload. Okay, in case CO2. This one is CO2. This one is O2. Quickly, guys. Quickly, guys. Yes, the answer is C. Erythrocytes low in BPG do not unload oxygen well. I hope you understand the concept. I said 2 more to go, right? Let's see. Hold on, just a moment. Yes, this question, I didn't ask any of them today. Look at this question quickly. After this one, I asked the last one. Look at this question quickly, guys. Which of the following issues output to the VRG to adjust the respiratory rhythm? Which one? To adjust. Okay, so there are 4 things you need to bear in mind now. And if you have pen and paper, you note them down. These 4 things. 1, you guys are very correct anyway. Which if they say adjust the rhythm, add. So DRG. Adjust the rhythm, add. DRG, that's A. If they say which one is the primary responsibility, its primary responsibility is to generate rhythm. This time around, it generates rhythm as its primary responsibility. It can be influenced by a lot of things, but you know, it's VRG. VRG. But if they say which one generates output, you understand, that helps you to do things, emotional things like laugh, cry. You see the way I'm laughing now. Which one is helping me to generate output that is making me to laugh, like emotional states? Oh, I'm so emotional right now. That is what PRG. You need to know the 3 of them. Oh, in case of they ask anyone, you'll be able to remember it. If they ask anyone, you'll be able to remember it. If you hear emotional, anything emotional, you're making emotional. That's PRG. If you hear anything primary responsibility, that's VRG. If you hear anything talking about adjusting, you understand, helping to adjust, that is what DRG. And they will ask you another question, which will be referring to the pH, like what the pH of the cerebrospinal fluid is monitored. What monitors chemicals? You talk about central chemoreceptor. Central, in short, if you see chemoreceptor, pick it. If you see chemoreceptor, pick it. You understand? I hope it makes sense to you. If they tell you which one helps to monitor pH, if you see central chemoreceptor, pick it. So my last question. No, I can't repeat. So let her go look at the video, all right? And write the time down now. Look at the video, all right? I repeated it 2 times, so you were not paying attention. So just go back and look at it. What is the list? Come on. My last question. I've already asked about the law that states that the total atmospheric pressure is the sum of the contribution of the individual gases. That's Dalton's law. I've asked that question. They love Dalton's law. They love what? Dalton's law. They love Dalton's law. That's just one thing I'll have to tell you. Okay, my last question. Take it, guys. Take it. What is the least common but most dangerous form of lung cancer? The least common but most dangerous form of lung cancer. Mesothelioma, adenocarcinoma, squamous cell carcinoma, small cell carcinoma, basal cell carcinoma. Answer. Okay. Yes, the answer is small cell carcinoma. You guys are so correct. Okay, so that's for respiratory. All right. You need to go back to these questions, look them as many times as possible. Look at the review video. Look at as many times as possible. Go to your the quiz I gave you. Look at the quiz. Do it. Do you understand? With this class now we've done, if you go to that quiz, I expect everybody this night do respiratory quiz. You understand? And do the next chapter quiz this night before you sleep. Just give them 30 minutes and do it. Do them. Just 30 minutes is enough to do each of them. You understand? You don't need to just pick your answer, then review it. Know which ones you fail. All right? So, guys, circulation or heart, which one comes next? I've forgotten which one I said will come next. Anyone we don't do now, we can do it tomorrow or next. Tomorrow is Monday, right? Did I say I'm going to meet you guys tomorrow? I don't think it will be possible because I have lab. Maybe on Tuesday. But let's finish today before we discuss. So, which one are we doing? Circulation hearts. Which one? Which one did you say we are doing? I forgot what I mentioned then. Hurry up, guys. Okay, circulation. So, no, don't worry. Anyone we didn't do, we can do it on Tuesday or Monday. I honestly don't think I'll be able to meet you on Monday, but if I can, I'll tell you. All right? I'll tell you. But Tuesday might be the most feasible. If I will not do it Monday, we'll do it on Tuesday, same time. Okay. You said this thing. So you said blood vessels, right? That's fine. We said heart after respiratory. Are we doing heart or we are doing blood? Are we doing heart or we are doing blood vessels? I need 5 people to say heart, blood vessel, or anyone, which of them. If I get 3 out of the 5, I'll move quickly. I don't know. Leave that. That one is not important. Any amount of question you get, you do. Let's just focus on what we are doing now. It means that you are not paying attention in class because we discussed it in class. I think it's 75 questions. So let me just make it clear. So heart, blood vessels, heart. Oh, heart has already won it. I said 5 people. So I'm going to heart. So tomorrow we can do blood vessel on Tuesday, all right? But meanwhile, please go do the quiz. Finish it. Every day you should do all of them. It won't take you more than 30 minutes for each. Don't okay. Can only say what I can say. Joke with it, it will joke with you. Let me see. Heart is chapter 19. Oh boy, this one is much. So guys, let's go into the yes. We are going to heart now. So let's go into the very fast mode, if you can agree. Mode, is it mode or mood? Mode. Yeah. So we're going to go into the very fast mode. Oh boy. Wow. Hold on, just a minute. Just a moment. I'm trying to check something. Okay, guys. Heart. Okay. I'm gonna mix the questions. I'm gonna mix the questions, both the true or false question. And if you see true or false, you answer. If you see multiple choice question, you answer. I don't want to separate it anymore. So let's go, guys. Are we ready? Are we ready? Let me see how many yes I will see. Are we ready, guys? Let me know how many people that are here. Only 1 yes. Okay, I'll count it. Let me know how many yeses. 1, 2, 3. Even the yes is so difficult for 22 people to type. I'll wait for you till I get up to 15 people. If I don't, I will end it. Okay, guys. Yes. Now you guys are activated. True and false. This question, true or false? The pulmonary circuit is supplied by both the right and the left sides of the heart. True or false? Quickly. The pulmonary circuit is supplied by both the left and the right sides of the heart. True or false? Quickly, my guys. Quickly. Yes, the answer is true. See, listen, if you are answering questions here, it's easy for you to remember it in the hall. All right. Even if you get it wrong, you'll be able to know, oh, when they gave this question, I got it wrong. What did I choose again? I choose true instead of false. You know, that kind of thing. So the answer is true for that question. This is the next question. The systemic circuit contains oxygen-rich blood. True or false? Only. True or false? The systemic circuit contains oxygen-rich blood only. True or false? True or false? False. You see, all these things, when they start saying only in medicine, it's always somehow, all right? Just remember that. It's always, just look at it very, very well. Okay. Yes, the answer is false. Look at this question. Which of the following carry oxygen poor blood? Normally, I should ask this question without options, but to make it faster, I'll put options for you. Which of the following carry oxygen poor blood? Pulmonary veins and vena cava, aorta and pulmonary veins, aorta and vena cava and pulmonary arteries, pulmonary veins and pulmonary arteries. Which one? Answer quickly now, guys. Just one person. Like, needs energy. I need energy. Just look at the question. Think of it. If you're in a hall, what should I pick? Pick that thing in your mind. Don't wait for people to answer, for you to answer. No. Which of the following carry oxygen poor blood? Which one carry oxygen poor blood? So, pulmonary veins and vena cava. Remember, pulmonary veins is what brings blood from the pulmonary back to the heart, and that blood it brings back is what? Is oxygen-rich blood. So A is out. Second one say aorta and pulmonary veins. Aorta takes out oxygen-rich blood automatically. So that one is out. The question is oxygen poor. You understand? Then the third one say aorta and vena cava. Aorta carries oxygen-rich blood. That's out. The E says pulmonary veins. Pulmonary veins carries oxygen-rich blood. Even as pulmonary artery carries oxygen-poor blood, but pulmonary vein carries oxygen-rich blood. So your answer is D, which is vena cava. Vena cava carries oxygen-poor blood. Pulmonary arteries carry oxygen-poor blood. So, you see, remember, pulmonary arteries carries blood out of the right ventricle to the lungs. So that's oxygen-poor blood. So the answer is D, vena cava and pulmonary what? Arteries. I hope that makes sense to somebody. Are we good? Yes, okay. Look at this question. Which of the following belongs to the pulmonary circuits? Which one belongs to the pulmonary circuit, guys? This one is a walk away now. I shouldn't even be asking this kind of question. How come I've not seen Michael today? Is Michael here? He's here. Michael is supposed to say, I am here. Not he's here. So which of the following belongs to the pulmonary circuits? Is pulmonary arteries and pulmonary veins. That one is straightforward now. Oh, Michael is Mims Breezy. That's not Michael. I know Michael's name on YouTube. The heart is enfolded in two-layered membrane called what? Quickly, guys. Quickly. Let's vibrate, guys. Let's vibrate. Why are we quiet? Let's vibrate. Let's vibrate. And somebody is doing like this. Is it you? Okay. Let me believe you. The spirit has not told me anything yet. One, two, three, four. What's happening? You guys are dulling me. I think you guys are tired, though. Maybe we should stop. Because, like, why? I keep begging you people to talk. I really don't. People, last semester, I don't used to beg them to talk. Even if we spend 6 hours, I've spent 6 hours with them and they are always very active. They're always very active. Everybody just keep quiet. Oh, some people have answered it. It doesn't matter. It doesn't matter. The answer is pericardium, yes, but you need to, tell me that you are here. That's the idea. I know you people know all these things. I know all of you know these things, but you have to tell me that you are here. The apex of the heart is found dash of the midline of the body. To the left, to the right, in the center. To the left, to the right. No, how did they sing that song? To the left, to the left. Who can sing that song? To the left, to the left. Yes, the answer is to the left. So yeah, that's where the apex is pointed. It's pointed this way. Okay. Let's see this. No, sorry. I made a mistake. Which of the following is most superficial layer enclosing the heart? Which one is the most superficial layer enclosing the heart? Which one? We have fibrous pericardium, we have visceral layer of the serous pericardium, we have endocardium, we have epicardium, we have parietal layer of serous pericardium. Quickly, which one is the answer? Oh, wow. Egypt is beating New Zealand. Wow. Interesting. Who is watching World Cup? Oh, you guys are still more too focused on midterm than World Cup, eh? Frankie say we are watching midterm. Please say we are watching you. Stop watching me. You need to be participating. Stop watching me. Which of the following is the most superficial layer enclosing the heart? It's the fibrous pericardium, guys. Fibrous pericardium. It forms the parietal pericardium. It's the most superficial. All right. Look at this question. Pericardial fluid is found between the dash and the dash. Pericardial fluid is found between the dash and the dash. We have the visceral layer of the pericardium. We have the visceral layer of the pericardium and the myocardium. We have visceral layer of the serous pericardium and epicardium. We have the parietal layer of the serous pericardium and visceral layer of the serous pericardium. Then we have the myocardium and endocardium. Then we have the epicardium and myocardium. Answer. Answer, guys. Quickly. We are slow. Oh, Jesus. Maybe I should start calling people by name. Mims Breezy. Oh, yeah. What is the answer? Afwa. Walid. I'm calling everybody name now. Dora. Who's Dora? Dora has not answered this question. I'll call if you don't answer now, I'll be calling your name. Natalie. Yes, Yanalis. Yes, the answer. Did you say B? No, the answer is not B, guys. Visceral layer of serous pericardium and epicardium. No, the answer is parietal layer of the serous pericardium and visceral layer of the serous pericardium. Have you forgotten that I told you, if this is the heart, the serous pericardium is enclosing the heart like this. Now, I told you that this outside is the parietal layer. This part that is touching it is what? Is the visceral layer. That's what I told you. And in between them is the pericardial cavity where the fluid is found. Please, it's parietal layer of the serous pericardium and visceral layer of the serous pericardium. All right? Please remember that. Know that and know peace. Hold on. Okay, look at this question. Anybody that didn't respond, I'll call the person's name. Look at this question. The dash performs the work of the heart. The dash performs the work of the heart. We have the fibrous skeleton. We have the pericardial cavity, we have the endocardium, we have the myocardium, we have the epicardium. Answer. If you don't answer, I'm gonna call your name. Yes, the answer is myocardium, all right? The answer is myocardium. And guys, please, they will ask you what is up at atrium, A before V. Sorry. What is up atrium? What is down ventricle? Chickener. Know that and no peace. What is up atrium? What is down ventricle? That's all you need to know. All right? So A before V. Atrium up, ventricles down. Atrium, upper chamber, atrium, inferior chamber, ventricle. You want me to sing it? I'll sing it for you. So if they ask you which ones are thicker, what will you tell them? He said I should sing. With this my terrible voice. The ventricles are the thicker and more powerful chambers of the heart. They pump blood to the lungs and the body. True or false? The ventricles are the thicker, more powerful chambers of the heart. They pump blood to the lungs and the body. True or false? True or false? Let's don't think. Before I finish you with my voice, right? The ventricles are the thicker and more powerful chambers of the heart. They pump blood to the lungs and to the body. True or false? Quickly, guys. The answer to that question is true. It's the simplest question you meet in the exam hall. Pray that it comes out. Now, look at this diagram. I want you to look at this diagram. Yes, they will bring some diagrams for you. Somebody was asking me about diagram one time, possibly. Look at this diagram, guys. If you want, I can expand it for you. Look at this diagram. Look at this part that is shaded. All right. They ask you, what is the structure? What is the structure highlighted? Guys, what is the structure highlighted? I don't believe you need options. We have the myocardium of the left ventricle. We have myocardium of the right ventricle. We have the myocardium of the left atrium. We have myocardium of the right. No, let me start again. Short, let me just type it before I call the wrong thing. But I believe that by now, some people should have even, picked the right answer. Look at the options here. Myocardium of the left ventricle, myocardium of the right atrium, myocardium of the left atrium, myocardium of the right ventricle, myocardium of the aorta. Aorta. Answer. Quickly, guys, quickly. Which one is shaded? If they give you something like this, what will be the answer? Yes, myocardium of the left ventricle. All right. Myocardium of the left ventricle. Yes, left ventricle. Look at how thick it is now. That's how you know. The left ventricle is the thickest part. It's so thick. If you look at, I don't know if you can see my mouse pointer. If you can see my mouse pointer, can you see my mouse pointer? Say yes or no. Can you see my mouse pointer? Say yes or no. Can you see my mouse? Yes, okay. So if you look at it, see the right, you see, this is the right atrium. See the right ventricle. Don't you see the outline of the right ventricle? You see how small? It's thicker than the atrium. So the ventricles are always thicker than the atriums. But if you compare this ventricle here to this guy here, you see how thick this guy is. This guy is so thick. Why? Because it's pumping against higher resistance. That's the what? The aorta. You understand? Unlike this guy that is pumping to where? To the lungs. To the, it's pumping to the pulmonary artery. But this guy is pumping to where? The aorta. Do you understand? So that's why it's thick. So because somebody will ask me, but how did I know? It's not even by where it's pointing. It's just by about, you know, the thickness most times. So look at this question. Look at this question, guys. The shallow depression seen on the external surface of the heart between the left and right ventricle is called what? Between the left and the right ventricle is called what? Coronary sinus, interventricular sulcus, interventricular septum, coronary sulcus, left atrium. Quickly, guys. Quickly. Let's go. Quickly, oh, my people. Oh boy. Why are we wasting time now? This thing is very... So guys, the answer is sulcus, not septum. It's interventricular sulcus. Sulcus. Listen, see the difference between sulcus and what's the other one? Septum. You see these two guys? Guys, watch me. Can you see? I'm looking, so let me make myself look bigger. You see these two guys? Assuming this is the two ventricles. Now there's this big thing here, this big wall here, this wall here. These two walls are called what? Septum. Septum is usually inside. So, but when you are talking about sulcus is, so you see this division above it is the sulcus. Sulcus is always the external. You understand? It can be a depression. It's always what? External. That's how you know sulcus. You understand? But septum is always, you see from the sound, tum, tum, septum is thick. It's, you know, it's thick internal muscular wall that physically separates the left and the right ventricular chambers. All right, but you understand when you're talking about the external, interventricular. You are talking about what? Sulcus. It overlies the septum. The septum is inside. The sulcus is just at the top. So if this part is the septum, this part will be what? The sulcus. Remember that. As far as they say external, always remember what? Sulcus. Okay. Perfect. Perfecto. Perfecto. Can see. So look at this, guys. The area where the major vessels lead to and from the heart chamber is called the dash of the heart. The pointy inferior portion is called the dash. This question is too cheap, I beg. It's too cheap. Apex, base, atrium, ventricle, ventricle, atrium, base, apex, endocardium, epicardium. A, B, C, D, E. Quickly. This one, you shouldn't even think about it. I'm not expecting. I was expecting that you wouldn't be thinking about it. Oh boy. What's happening now? Am I lagging? Because I'm surprised nobody's talking. Am I lagging? Only one person talk after 5 minutes. Let me wear my cap. Alex, what's your answer? I'm not lagging. So why are you people not responding? So what's the answer, guys? Somebody say, "Ewo, professor." Somebody say, "No." Memes breezy. Michael. Somebody's laughing. Oh yeah, what's your answer? Prissy, what's your answer? Anyway, this one is too cheap, so let me not even beat you people for it. It's too cheap. Let me look for something more complex. But the truth of the matter is that your exam is very cheap. It's a very cheap exam. So if you know what you are doing, if you study very well, you understand. If you are, Prissy, you have answered. So if you focus on what we are doing, you'll be fine. You understand? You'll be very, very fine. Look at this question. Quickly, guys. It's cheap for you. That's why you are not answering, because if it's not cheap for you, you will be attempting it. The right AV valve regulates the opening between the dash and the dash. Quickly. Please leave me alone. The right AV valve is opening between dash and dash. Quickly, guys. Right atrium and what? You just say right atrium and ventricle. You have to be specific. Remember how blood moves. I won't discuss it. I won't discuss it. The answer is right atrium and right ventricle. It's very straightforward. You have to, guys, let's focus, man. Let's focus. Somebody said atrium and ventricle. That can't be the answer. Right AV valve cannot be between atrium and ventricle. You have to be specific. There's right AV valve, there's left AV valve, right? The right AV valve is the tricuspid, left AV valve is the mitral. You understand? So you need to remember this thing, and you remember what and what they are in between. Look at this, guys. Oxygen poor blood passes through the. Where does oxygen poor blood pass through? From this option. If you are tired, maybe we stop. If you are not tired, then you have to show me by answering faster. Right AV and pulmonary valves, right AV valve only, left AV and aortic valves, left AV valve only, pulmonary and aortic valves. Quickly. Oxygen poor blood, where does it pass now? We've discussed this kind of, I think I've actually asked this question before, right? Have I asked this question before? Okay, yes, I've asked this question, but I didn't talk about valve. Okay, this one now, you see, this question, I've asked this kind of question before. It was talking about vessel. When we mentioned where does oxygen poor blood pass through, we mentioned the vena cava, and we mentioned what the pulmonary artery. So now we are talking about valve. Which valve does oxygen poor blood pass through? So it's almost exactly the same question, but this is now talking about what? Valve. Yes, that's for that other question. So this one now is talking about valve. What's the answer? Oh, sorry. Sorry. I actually pasted it here thinking I still shared. So when you say tired, I heard retired. No. So yes, the option is right AV and pulmonary valves, right AV valve only, left AV and aortic valves, left AV valve only, pulmonary and aortic valve. Sorry, it was my fault. I didn't post it. I thought I did. You said the heart. Okay, let me remove it. I know you don't like this heart. You've been looking at this heart since. Let me safely keep it here before you steal it. They want to steal my heart. This heart that my ancestors gave me. So you need to know the vessels, you need to know the valves. The options I've already posted it. Look up. Or this direction. Look up. So without wasting time, the answer is the right AV and the pulmonary valves. We already know this, so let me not waste time. The right AV valve, the pulmonary valve. They ask questions on valve, so please, you cannot confuse any valve. You can't be confusing valve. You can never confuse valve, all right? Look at this question. The dash valve regulates the flow of blood between the right ventricle and the vessels leading towards the lungs. Which valve? Even without me talking about it, putting option, you should know the answer. For people that knows it, you can't be using option. You should already know the answer. The dash valve regulates the flow of blood between the right ventricle and the vessels leading to the lungs. Simple. What's the answer? Leading to the lungs. What's the answer? (911). Mitral. I'm waiting for the others. Mitral. Continue, guys. So look at this diagram, guys. Because why I brought out this diagram now is because a lot of people are picking mitra, and I'm scared. All right. So let's look at this. Somebody say 911. Look at these valves. This A, B, C, D, right? Uh-huh. Look at these valves. This is the right. This the right AV valve. That's the tricuspid valve, right? Between the right atrium and the right ventricle. You see, this is the valve. Blood flows here. Then from here, blood flows through the pulmonary artery. This is pulmonary artery. And which valve is this? This is pulmonary valve. You see, this is pulmonary valve. Now, what are they asking you? What's that question? The question says the dash valve regulates the flow of blood between the right ventricles. What is the right? Where is the right ventricle? This is the right ventricle. This is what they're asking you. The right ventricle and vessels leading to the lungs. Which vessel is leading to the lung? Is it not this vessel? So what they're asking you is this B. So what is B? What is B? It has to be what? What is B, guys? I'm waiting now. The people that said mitra, what's the answer now? But as I've just explained it. Pulmonary, of course. So you have to, you understand, you really need to understand the question. They told you the right ventricle, this is the right ventricle, and leading to the pulmonary. So this must be the pulmonary distance. You're talking about mitra. This is mitra now. Mitra is in, this is the right atrium, the left atrium, this is the left ventricle. This is mitra. Then from here, blood goes to the aortic. This is the aortic. Okay. I hope you don't get that question wrong in exam. So that's why I said you must know your valves properly. You must know your valves properly. And look at this question about the tendon. The caudate tendon of the AV valves are anchored to the dash of the ventricle. They are anchored to the what of the ventricle, the caudate tendon. They are anchored to the what of the ventricle, guys. Papillary muscles, pectinate muscles, trabecular canal, interventricular septum, and interarterial septum. What's the answer? The caudate tendon of the AV valves are anchored to the dash of the ventricles. Guys, let's vibrate. Let's vibrate. Let's vibrate. Let's vibrate. Let's vibrate. Let's vibrate. Only two persons answered. Let's vibrate. Egypt has won now, 3-1. Where is Mims Breezy? Is Williams here? Yes, the answer is papillary. So look at it now. What did they ask you? They said the caudate tendon of the AV valves are anchored. So this is the AV valves. This is one of the AV valves. This is another AV valves, right? Atrioventricular valve. This is the AV valve. See this thing now. This is the tendon. This is the caudate tendon anchoring this AV valve here. This is the caudate tendon. Where is this caudate tendon anchored? That's what they're asking you. Where is this caudate tendon anchored? This caudate tendon is under this muscle. This papillary muscle. This is papillary muscle. I believe everybody understand that. That's why I'm going to keep that picture. What carries blood towards the lungs? We know this, pulmonary trunk and arteries. They carry blood towards the lungs. So I'm not going to ask that question. It's too cheap. It's too cheap. Look at this question, guys. After entering the right atrium, the farthest okay, I see you. After entering the right atrium, the farthest a red blood cell can travel is the dash. The farthest a red blood cell can travel is the dash. This is a very technical question. And let me see. Let me paste it here. Okay, answer, guys. Interesting question. I pasted the options already. Right ventricle, pulmonary trunk, superior vena cava, ascending aorta, and left atrium. After entering the right atrium, the furthest a red blood cell can travel is the dash. Quickly, guys, quickly, quickly, quickly. You are giving question marks. What are you asking? Is it you don't understand the question? They are just telling you to. These people are just. It's just telling you. Uh, yes. So the answer is superior vena cava. It's very straightforward. After superior vena cava, what do you get? The red blood cell is in our blood. So this is superior vena cava. They said from the right atrium. From the right atrium, if you go around the body and get to the right atrium again, before the right atrium, what do you see? Vena cava. And that is your answer. They are just playing with you, guys. They are just playing with you. Like, this is just something you see. This is the kind of question you see and you laugh. It's like, what the hell are these people playing with me? All right. Okay. Okay, what causes opening and closing of the heart valves, guys? Hmm? Opening and closing of the heart valves is caused by what? Breathing, gravity, venous contraction and relaxation, valves contracting and relaxing, osmotic gradients, pressure gradients. What causes this? Opening and closing of the heart valves is caused by what? Oh boy, 11:10. We have to finish this thing quickly. If you answer quickly, we'll finish quickly, guys. The problem is that you guys are not answering quickly. Quickly, guys. Yes, pressure gradients. Let me not waste time. Pressure gradients. Yes, it works with pressure gradients, all right? Pressure builds up and when it's too high, it opens up or closes the next area. So they may ask you also, you need to know how the blood moves, right? Because they may ask you which of the following blood vessels receives blood directly from the right ventricle. Which vessel from the directly from the right ventricle? You should know right ventricle has to be what? Has to be pulmonary trunk. Do you understand? You need to know how it moves, how blood moves. Look at this question now. They're asking, uh, They say which of the following blood receives, which of the following blood vessel receives blood directly from the right ventricle? If you look at this picture, this is the right ventricle. So where does blood go to? Straight. This is pulmonary trunk, and you are good to go. You understand? So you need to know this thing. No, I'm not gonna ask all the questions. You need to know the the entire nitty-gritty of the thing. Now, this question is the question I always discuss. True or false? Blood in the heart chambers provides most of the myocardium's oxygen and nutrient needs. True or false? True or false? Yes, the answer is false to that question. You're right. Not the chamber, it's the coronary vessels. And that's why I want to ask you this question. Look at this question. When an obstruction in which of the following will cause the most severe myocardial infarction? Left marginal vein, left coronary artery, posterior interventricular vein, anterior interventricular branch, circumflex branch. An obstruction in which of the following will cause the biggest myocardial infarction, MI? Quickly, guys. Only Frankie? What's happening? Frankie, are you the only person in this class? So this is the pathway of blood through the heart. You understand? This diagram is actually very self-explanatory. We are here. Yeah, this diagram is actually very self-explanatory. So it's very good that, you know, if you have a phone now, if it's big enough, you can screenshot it and remember it. You understand how this blood moves because it's very well labeled than the other ones. You need to know this movements. You must know these movements. You understand? From number 1 to number 10. Extremely important. You must know these movements. All right. Okay. An obstruction in which of the following will cause? Yes. The answer is B. Let me see. That B. Yes, left coronary artery. Remember, left coronary artery. Very, very important. Left coronary artery. All right. It's part of the coronary. I've asked this question. Look at this question. This one is very simple. I don't even know why I'm asking it. Cardiac muscle can only use glucose as a source of organic fuel. True or false? Oh boy. Are we sleepy? Don't worry. I don't have a lot of questions for blood, so I should be done very soon. But that's if you guys are fast. But you guys are slow. You are sleepy, so we should stop. If you want us to stop, we'll stop. Which of the following is a feature shared by cardiac muscle and skeletal muscle? Oh, that answer is false. Yes, that answer is false. It has a lot of other places it can get, fuel. So I'm moving to this one. That answer is very easy. Look at this one. Which of the following is a feature shared by cardiac muscle and skeletal muscle? Which one? Let's go now, guys. Let's go. Which of the following is a feature shared by cardiac muscle and skeletal muscle? Muscle fiber striations, dependence upon nervous stimulation, communication via electrical junctions, intercalated disc, autorhythmicity. They said, which one is shared? Which one is shared? Which of the following is a feature shared by cardiac muscle and skeletal? So they're asking you, which feature does cardiac muscle have and skeletal muscle have? Somebody said intercalated disc. Cardiac muscle has intercalated disc. Does skeletal muscle has intercalated disc? Hmm? Cardiac muscle has intercalated disc. Does skeletal has intercalated disc? Skeletal doesn't have intercalated disc. Oh. You understand? Instead, for intercalated disc, what skeletal has is alternating light and dark bands. So that intercalated disc, alternating light and dark band, what is it called? The two of them together, the two of them, what are they called? Because that will be the shared feature. Where is everybody? Why is nobody talking? It's still the same group, but let me go up. Oh, come. Maybe I've not been. Let me go up. Where is Walid? Walid has run away. Where is Mims Breezy? I have not seen him. He disappeared. Tammy. Black Angel. Yes, the two of them is called muscle striation, muscle fiber striations. The two of them have striations. And for skeletal muscle, the striation is what alternating light and dark bands. That's what causes the striation. For what is it called? For cardiac muscle, what causes the striation is intercalated disc. It's okay, Frankie. It's okay. It's fine. Like it's better that you get it wrong here with me. That's the idea of this. That's the idea of this tutoring. All right, get it wrong with me. Get it right in the exam hall, and I'm good. I'm fine with you. All right. So that's the point. Yes, that's the point. Like now you know it. So if you see it again, and it's good that you attempted it. If you see it again, you won't fail that question. Do you understand? That's why I took time to explain it. All right. Okay. So look at this. Which of the following is not a feature of cardiac muscle? They depend almost exclusively on aerobic respiration. That's A. They are rich in glycogen. That's B. They have larger than average mitochondria. That's C. They are very rich in myoglobin. That's D. They have about the same endurance as skeletal muscle fibers. Quickly, guys. I can't continue mentioning, calling everybody's name. Which of the following is not a feature of cardiac? And also, when you're answering question, no, they can't be listening from work and clinical. No. I won't take that. If you want to be listening, then maybe we can call it off whenever they are available. I need you guys to be available. Like coming back or listening while driving from work and clinical, it doesn't cut it for me. All right. I need you to participate. That's why I'm here. That's why I'm here awake by this time talking. You get? So if you guys are too busy and you are with work, then I'll stop. When you are less busy, tell me. I always will make out time for you. You guys are my people. I always make out time for you. But what I don't want is when I'm talking to myself and somebody's telling me you are listening, driving. No, this is your exam. So if the work is more important, then focus on the work. All right? I need everybody to participate. At least more than half of the people here should be participating. A situation whereby this is 18 people, which should not be 18 people, at least 9 to 10 people should be participating. All right? Not just one person. And yes, they have about the same endurance as skeletal muscle. No, it's not the same thing. It's not the same thing. Skeletal muscle tires very fast because it produces lactic acid. You understand? But the heart keeps beating. The cardiac muscle keeps beating. All right. If the cardiac muscle tires out, that will be a problem. Do you understand? Look at these questions. This question: true or false? These bosons form channels that allow each cardiomyocyte to electrically stimulate its neighbors. Desmosums form channels that allow each cardiomyocyte to electrically stimulate its neighbors. True or false? True or false? Mm-hmm. Quickly, guys. So, guys, if you see one intercalated disc and another intercalated disc, Eh? Intercalated disc has two things. One is desmosome. Another one is what? Gap junction. They may ask you any of them in exam. You need to know the difference between the two of them. Desmosomes is mechanical. You understand? They help to anchor. So desmosomes more or less like they just, just mechanical anchor. So this is one cardiomyocyte. This is, no, let me use this my stuff. One cardiomyocyte, another cardiomyocyte. In it, you see desmosomes. Down here, you see hemidesmosomes. But in between the two of them, you see desmosomes. Just anchor. Anchoring each like a gumming each other. It's different from gap junction. What desmosome does is to avoid the two of them tearing. That's desmosome. So desmosome is a physical joining, anchoring the two of them. And the two of them are standing on this floor, this basement membrane, using what? Hemidesmosome. But between these two is what? Desmosome. Now, still in the middle here, you will see what? Gap junction. Gap junction is strictly electrical. It allows ionic channel. It's an ionic channel rather, not a physical anatomic anchor. No, it's an ionic channel that allows what? Ions to flow in and out. So you need to understand gap junction and what? Desmosome. So this question is asking you, desmosomes form channels that allow each cardiomyocyte to electrically, immediately you hear electrically, it's talking about gap junction. Desmosome, not electrically. You understand? Not electrical. It's just a mechanical anchor. I need you to know the difference between the two of them. They may ask you hemidesmosome. Hemidesmosome is one. If this is two cardiomyocytes, this is desmosome and the gap junctions in between them. Like this is what? Hemidesmosome. Okay. So any question talking about electrical is talking about gap junction. Remember that. All of you know the pacemaker of the heart. So I'm not talking about pacemaker of the heart. It's the SA node. Everybody knows pacemaker. We know the conducting system of the heart, right? When I told you about the man and the main wife and the side chick. So which of the following is not part of the cardiac conduction system? Which of the following is not part of the cardiac conduction system? We have the SA node, we have the tendinous cords, we have the AV node, we have the AV bundle, we have the subendocardial branches. Let me post it. Which of the following is not part of the cardiac conduction system? Look at these options and tell me which one is not part of the cardiac conduction system. Which one does electricity not flow through? Only Walid is answering. Walid is A and B. So I should choose one, right? Hey, Walid. Where is O'Connell? O'Connell was here initially. Where is he? And where is Delaney? Delaney. Where is Delaney? And where is Afua? I've not seen Afua recently, in recent memory. Where did she go to? Yes, guys, the answer is tendinous cord. Tendinous cord has nothing to do with anything, electricity, all right? It's just a muscle stuff. Come in. Okay, look at this. Okay, all of them are back. I didn't still see her for she disappeared. So the pacemaker potential is a result of dash. Pacemaker potential is a result of dash. Hmm? It's a result of what? Pacemaker potential is a result of what? Look at the options. Sodium inflow, sodium outflow, potassium inflow, potassium outflow, calcium inflow. Which one is the answer? Pacemaker potential is as a result of dash. Which ion? That's what they're asking you. Sodium inflow, sodium outflow, potassium outflow, calcium inflow. Say damn. Maybe E. Always remember that it will never be calcium. It's always sodium. All right. Mm. So is this sodium going in or coming out? Which one is it? And yes, the answer is what? Sodium going in. That's inflow. All right. So remember that. Remember that. If the SA node is damaged, the heart will likely beat at. If the SA node is damaged, if the main wife is out, the side chick takes over. The side chick beats at what? What's the heartbeat of the side chick? 0 to 10, 10 to 20, 20 to 40, 40 to 50, 70 to 80. What was the answer, guys? I will soon be done. I'm almost done, guys. Yes, the answer is D, 40 to 50. Very important that you know that. Okay, look at this question. The plateau in the action potential of cardiac muscles results from the action of dash. It results from the action of dash. Sodium inflow, potassium outflow, fast calcium channels, slow calcium channels. The plateau is what? Hmm? Quickly, guys, quickly. Yeah, 40 to 50. That one we've passed through. The plateau in the action potential of cardiac muscle results from the action of what? Results from the action of what? Quickly now, guys. Okay, yes. The answer is slow calcium channels. Yes, slow calcium. That's E. Remember that. No that and no peace. Look at this one quickly. True or false, guys? Repolarization of a ventricular cardiomyocyte take longer than repolarization of a typical neuron. True or false? Hmm? True or false? Quickly, guys. Quickly. We're almost done. True or false? The answer is true. Guys, also remember that what provides calcium to the heart, you understand, for myocardial contraction is usually what? Sarcoplasmic reticulum. In sarcoplasmic reticulum, calcium is being stored. If you see calcium, search for sarcoplasmic what? Reticulum. Not Golgi, not mitochondria, not cytoskeleton. Sarcoplasmic what? Reticulum. Sarcoplasmic what, everybody? Sarcoplasmic what? Reticulum. Like, don't talk. Look at this question, guys. The long plateau in the action potential observed in cardiomyocyte is probably related with dash, staying longer in the cytosol. With dash, staying longer in the cytosol. Sodium, potassium, calcium, chlorine, sodium, potassium, calcium, chlorine. Then the last option, that option is sodium, potassium, and calcium. Like the three of them are together. Let me put it properly. Something like this. What's the answer, guys? The long plateau in the action potential observed in cardiomyocyte is probably related with what? With dash, staying longer in the cytosol. We already answered this question before. It's the same thing. We already answered this question before. So what's the answer? What causes plateau? We answered what causes plateau before. I asked the same question now. You guys don't know it. What causes plateau, my people? We are 15? Oh, okay. That means everybody has gone now. Then maybe we should stop here. Okay. So, you know what? Since you guys, I think you guys are tired, I'm going to stop now. But before I stop, I'm going to take show you some diagrams. Then I can't continue because most of you are already tired. We've already treated almost 40 questions on this. There are about 10 to 15 questions we're supposed to still treat, but I think we have to pass on it on that. You understand? So let's look at the diagrams quickly. Let's start with this particular diagram. What kind of questions can they give you from this particular diagram? They can ask you questions like, which valve has 3 cups? You understand? So I think something like that. Which, okay, they may say, which valve is not generally represented with 3 cups? Which one is not generally represented? Like they know that, okay, oh, this valve is specifically not 3. You understand? So you are thinking, oh, maybe which one is two? You understand that kind of thing. And what are you thinking about? You are thinking about bicuspid, exactly. So which one is bicuspid in that diagram? Because one thing is to know it, another thing is to be able to point out bicuspid. Which one is bicuspid in that diagram? I'm listening. Which one is bicuspid in that diagram? Perfect. C is bicuspid. Yes. Yes. So they may ask you, through which valves does blood go to the lungs? Which one takes blood to the lung? Which valve? A, B, C, D. Which valve takes blood to the lungs? B. Okay. I agree. Let me see. They will ask you which one represents my mitral valve. Everybody knows mitral. Which letter represents mitral valve? Everybody knows that. Okay. They may ask you this question. Yeah. Eh? Mitral valve? Did somebody say A? Let me see the diagram again. Mitral valve. Which one is mitral valve? You say A. Mitral valve is which one? Frankie, which one is mitral valve? Isa. Isana, which one is mitral valve? C. Okay. I thought you said A, so I wanted to shout now. Okay. Yeah, see. I said C. Okay, perfect. I just want to be sure you know the answer. Okay, look at this option. They say which valves are connected to Cody tendon? Which ones are connected to Cody tendon? No, that's fine. That's fine. Which valves A, B, C, D? Which ones are connected to Cody tendon? What was the answer? Which valves are connected to the Cody tendon? Yes, you guys are so correct. It's A and B. Yes, A and B. And through which valves does blood exit the heart? Through which valves does blood exit the heart? Through which valves does blood exit the heart? Exit the heart. Think about it. Through which valves does blood exit the heart? Let me go back to this place. Um, Look at this, guys. Blood enters the heart through this place, right? Atrium, right atrium. It crosses the right ventricle. This guy is just AV valve, right? So this is the heart. Blood goes outside the heart to the lungs through which valve? This valve here. All right. Then after it comes back into this place, passes this guy, then exits the heart again through D. So it exits the heart in through two valves, pulmonary valve and what? Aortic valve. So let's go back to this diagram. Which one is pulmonary valve? D. Which are aortic valve? C. So CD. The answer is CD. Exactly. So those are the two that blood exits the heart. All right. So you have to remember that. Hold on. Yeah. What about this one? See this diagram? You see? So which structure is the pacemaker of the heart? Which one is pacemaker? A, B, C, D, E. F, G. You can put F and G if you want. Which one is the pacemaker of the heart? Which structure is the pacemaker of the heart? Who said D? No, it can't be D. The pacemaker is A now. The SA node. Look at the SA node now. Remember, they say it's sinoatrium. It's in the atrium, just below here, sinoatrium, in the sinus of the atrium. This is it, SA node. The answer is A, all right? So let me see this diagram. See this diagram, guys? I believe you can see it from wherever you are. I'm going to ask you a few questions on it. A and B. Aizana, I don't know which question you are really answering, but we are in another question now. During which part of the ECG are the ventricles repolarized? A, B, C, D, E. What's the answer, guys? Here's the question. You'll most likely be able to see. What's your answer? During which part of the ECG are the ventricles repolarized? Let's go, guys. Let's go. Let's go. Let's go. Heat up the engine. Is it just these four people here? Where are the others? Yes, the answer is C, please. During which part of the ECG are the ventricles repolarizing? Please, the answer is C. Don't fail it in the exam hall. Don't. Okay, during which part of the ECG are the atria depolarizing? Please, the answer is C, not B. Ventricular depolarizing is C. Atrial depolarizing is what? Ventricular repolarization is C. Ventricular repolarization is C. Atrial depolarization, sorry, ventricular repolarization, atrial depolarization. So atrial depolarization is which one? A, B, C, D, E. Mm-hmm. D. Atrial depolarization is A, guys. Atrial depolarization is A. What of atrial repolarization? You have to know the, is it the terminologies? What of atrial repolarization? Repolarization. Repolarization. No. A is atrial depolarization. What is atrial repolarization? Say behind B. Atrial repolarization is which one? Come on, guys. It's B. Okay. It's B because if I keep waiting. Then this last diagram before I leave you guys. This one is very simple now. This one is very, very simple. Where is it? This diagram. They ask you through which valves does blood go to the lungs. You should know this now. We already did it here. So I'm not going to waste too much time on it. Then they say which one represents my mitral valve. We've discussed it. Then they say which valve is not generally represented with three cups. C bicuspid. Okay, we've discussed it. So, guys, I think I'm gonna. Oh, I forgot one. Oh, or maybe I should just leave it since people are tired. Look at this, guys. They will ask you through which valve does blood flow to enter the vessel. B. Through which valve does blood flow to enter vessel? B. What's the answer, guys? Let me see somebody that understands the architecture of the heart properly. Through which valve does blood flow to enter into vessel B? No, no. Listen. I just posted the question. The question is through which valve does blood? They are asking you what is the name of the valve. Option here, you are not seeing valve. Are you seeing any valve? So you have to give me the name of the valves. Valve. Through which valve? Look at the question well before you answer. Through which valve does blood flow into, or does blood flow to enter into vessel B? What is your answer, guys? First of all, you should know what vessel B is. Then you know the valve that blood flows into it, passes to enter it. I'm waiting on you guys should give me answers. Aortic. This is aorta now. B is aorta, so it's aortic. Guys, what is happening? You guys are. You guys are. So where does blood in vessel E flow to? It's aortic. Where does blood in vessel E flow to? Where does blood in vessel E flow to? Perfect. Right atrium. Now you guys are awaking from your slumber. You are tired, and me is what? Me that is talking. You that is just there sipping matcha. You are tired. I think I'm not. See, listen, you have to pass. That's just my own. I don't care whether you're tired or not. You have to pass. As far as you are with me, you must pass. So I'll ask you two more questions and I'll leave you guys, all right? Just two more questions. Look at this question. True or false, guys? Under normal condition, the amount of blood pumped through the pulmonary circuit is less than the amount pumped through the systemic circuit. Sure, enjoy. Under normal conditions, the amount of blood pumped through the pulmonary circuit is less. True or false? False, exactly. They are the same thing. Guys, you must know the difference between stroke volume and cardiac output. Any question and they say, oh, the amount of blood rejected from the right ventricle, left ventricle, or from each ventricle in 1 minute. Immediately you hear 1 minute. What is your answer? Cardiac output. Do you understand? The answer must be what? Cardiac output. The volume of blood ejected by ventricle in 1 minute. Your answer must be what? Cardiac output. I'm serious. I think I should leave you guys. Look at simple, this kind of cheap question, but like they can ask you this very cheap question. True or false? This question. Parasympathetic stimulation reduces heart rate. True or false? Everybody should know this one now. Wow. Parasympathetic reduces heart rate. It's true now. How can you say false, my friend? Parasympathetic. When you are parasympathetic, are you not relaxed? Your heart rate reduces. When you are sympathetic, sympathetic action. You get it? Aha. Perfect. Look at most of the ventricular filling occurs. Where do most of the ventricular filling occur? Let me give you these options. See the options here. During atrial systole, when the AV is closed, during ventricular systole, during atrial diastole, during isovolumetric contraction. Most of the ventricular filling occurs where? During where? Ventricular filling. Filling is relaxation. Ventricular filling. Most of the ventricular filling occurs during it's not true for us. This is options. I'm already giving you. Yes, the answer is during atrial diastole. You're correct. During atrial diastole. So, guys, last question. No. See, let me leave you guys. You are tired. Me, say I'm tired. Tomorrow I'm not sure I'm gonna have time to talk to you, but if I don't have time tomorrow, it will be next tomorrow. But I will inform you before 5 o'clock. If I'm back from the lab, I will tell you tomorrow on time. All right. Thank you very much. We ended up at 16. That's not a good number, but it's fine. Please, guys. You see how I'm begging you again now. Thank you so much, guys. Please go to your Canvas. For people that are in CSI, go to Canvas. Do those 7 quizzes I gave. Study them every day. Do all of them every day. Do all of them. Like bring out 3 hours. Do all of them every day. Bring out 3 hours. Do all of them every day. Watch this video as many times as possible. The link is there already. The same link. It's on my live. You keep seeing it. Subscribe to the channel. Click like. And thank you so much. And good night. I keep saying the same thing, Walid. Focus on the quiz. Focus on these videos that we did. We've done this is the second review we did now. First review we did endocrinology and something, urinary system and something. No, we did urinary system and lymphatic system. That's the first 2. Then we did these 2 now. All right, that's 4 chapters. So even if we don't do another review, you are good. That's the truth. Out of the 7, you've done 4 reviews. But I'll try to know if I can bring out time between Monday and Tuesday. If I can bring out time Tuesday, I'll know how many people will be available on Tuesday. Then, if there are a substantial number of people that are going to be active on Tuesday, then we do it. If not, we'll leave it. You are good. Even with the quizzes online, you are wonderful. Trust me on that. All right? So, let's call it a night. I will go on off in the next 30 seconds. If you have any question, you can drop it in the comment section. If not, I'm going off in the next 30 seconds. Thank you so much. Good night. 1. I always do my counting. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, good night. Going off now and stream.